Clinical guidelines for treatment of mental health anger issues. Please note that there are broad categories of signs and symptoms when experiencing anger issues, and symptoms or signs can vary from person to person. Let us review 20 symptoms you may encounter. Record of extreme outbursts. History of making threats. History of assaults. History of destruction of property. Overly sensitive. Hostile to minor irritants. Quick to label. Quick to judge others. Verbally abusive towards others. Disparagement of authority figures. History of exposure to explosive behaviors at home. Passive aggressive. History of physical trauma. History of emotional trauma. History of substance abuse. A history of low frustration tolerance. Feeling loss of control over one's thoughts. Racing uncontrollable thoughts. Feeling loss of control over one's actions. Exudes body tension, aggression, resistance. The DSM-5 code and ICD-9-CM code recommended diagnosis for individuals with major anger issues is 312.34, F63.81, intermittent explosive disorder. Let's look at 6 disorders with similar symptoms or signs, known as differential diagnosis. 1. Disruptive mood dysregulation disorder, characterized by a persistent negative mood state, such as irritability, anger, and nearly every day. This diagnosis can only be given when the onset of recurrent impulsive aggressive outbursts started before the age of 10 years. 2. Antisocial personality disorder. Antisocial personality disorder also displays recurrent problematic impulsive aggressive outbursts. However, the level of impulsive aggression is lower than intermittent explosive disorder. 3. Borderline personality disorder. Borderline personality disorder also displays recurrent, problematic impulsive aggressive outbursts. However, like antisocial personality disorder, the level of impulsive aggression is lower than intermittent explosive disorder. 4. Delirium, major neurocognitive disorder, also characterized by aggressive outbursts, but there is an existent medical condition or diagnosis that better explains the history of impulsive aggressive outbursts. 5. Substance intoxication or withdrawal. Impulsive aggressive outbursts can be associated with individuals suffering substance intoxication or withdrawal, unless the aggressive outbursts often occur in the absence of substance intoxication or withdrawal. 6. History of child-onset attention deficit/hyperactivity disorder, or conduct disorder, or oppositional defiant disorder, or autism spectrum disorder. The level of impulsive aggression in individuals with a history of one or more of these disorders has been reported as lower than comparable individuals whose symptoms meet an intermittent explosive disorder diagnosis. The DSM-5 diagnostic criteria for intermittent explosive disorder is 1. There must be a presence of recurrent behavioral outbursts that represent a failure to control aggressive impulses, as manifested by either of the following: verbal aggression, tantrums, fights, arguments, or tirades. 2. Within the last 12-month period, there were at least 3 behavioral anger outbursts involving damage to property or physical or verbal assault, and the magnitude of aggressiveness expressed during the recurrent outbursts is grossly out of proportion in relation to the provocation event, or to any precipitating psychosocial stressors. 4 important areas to consider when setting goals and strategies for a treatment plan for individuals with major anger or hostility issues. 1. Ensure the cooperation for further evaluation or testing to rule out or identify other coexisting disorders, and the assure safety, comfort of patient or others around patient. 2. Identify antecedents, triggers, and specific patterns of verbal or physical aggression, and the targets of aggression. 3. Increase communication skills and teach how to deal with daily stressors, and increase levels of tolerance, comprehension, calmness, and the physical ability to release stress by pursuing stress-releasing activities. 4. Teach how to verbalize interpersonal conflict issues, and learn how to verbalize and demonstrate positive feelings toward others, increasing feelings of security and appreciation for others. Reach us at therapytools.us, and don't forget to subscribe for future videos and share. Also, check how to organize and simplify a mental health treatment plan with the Adult or Child Treatment Planner apps for Windows or Apple operating systems. All proceeds go to charity.